Good morning, everyone, and good evening in India. Migraine affects over 1 billion people worldwide. Management of migraine naturally with yoga pranayam, acupuncture, and acupressure has yielded success outcomes. In this session today, we are going to talk about how you can control migraine with natural therapies. I am Amita from Narishtag, a platform for natural, holistic, and integrative therapies. Presenting this topic, we have Dr. Guru Dutta, who is a qualified physician in naturopathy and yogic sciences. Dr. Dutta is also certified in advanced tongue diagnosis, traditional Chinese medicine for fertility, and traditional Chinese medicine for mental health from AcuPro Academy in Canada. Welcome, Dr. Guru Dutta.
Namaste to everybody. Namaste Amitaji. It's a pleasure having our second webinar now. And
Yes.
Good morning everyone in the US, in the Western world, and good evening everyone in India and eastern part of the globe. Migraine.
Yes, so let's get started. Let's just start with the overview of migraine.
Yes. I would say that migraine is such a big condition affecting nearly 1 billion people across the globe. You can imagine what is the kind of effect it has on the human race. And it is understood by several statistical analysis and everything that it is the third most prevalent illness in the world. And it's the sixth most disabling illness in the world today. And at any point of time, this is most commonly affecting people in the age group of 18 to 44, 45. I have myself seen that many of the migraine sufferers after 40, 45, without any reasons or any kind of symptoms, they just wane off and they don't complain back. The reasons for that is still to be understood. Actually speaking, the reason or the causes of migraine is still to be understood completely. It is not understood with our medical science yet. Traditional sciences do have a concepts about that, and we are going to discuss about that as well as we go along. But unfortunately, we also need to understand most of the migraine sufferers are women. 80 to 85% of them are women. Our reason again is still not understood. And this diminishes the quality of our life to a large extent. To be very frank, I have suffered with migraine myself, and I have taken therapies across maybe acupuncture and working with the diet and yoga therapy with pranayams, asanas, relaxation techniques, and it has helped me a lot. And I've used acupressure also myself on that to manage. And last couple of years, I have been off the migraine attacks. Luckily, probably the reason is I'm 40 plus now, so that may be the reason why it has happened to me. But I have also seen several people in the last 20 years of my practice suffering from my headache for decades together and being on medication almost like every day, 3 times, and suffering with migraine headaches for 3 to 4 times a week, sometimes 5 days a week as well. So let us discuss and understand how it happens, what are the trigger factors, and how can we manage it. Amitaji, can we go to the next slide?
Yes.
Uh, in terms of migraine symptoms, we need to understand that we have 4 different stages. We call them as prodrome, aura, the attack itself, and the postdrome. These are the different kind of symptoms, how it presents. Usually, uh, I'll come to that later. There are some triggering factors which can cause this as well. In the prodrome itself, some of those things can be seen. The first thing I generally ask if somebody comes to migraine with me is, what would be the triggering factors for you? How does it come to you? When did it come? And is it a sudden onset? Do you have a family history? These are the history information we take from the patient and then try to analyze it. Most of the migraine sufferers are photophobic, means they are very sensitive to light. Even the sound, sometimes even the deos and even the perfumes what we use can be very strong triggering factors for them to develop a migraine attack. And also I have seen many times even some cravings of foods. Probably most of them, in my experience, I have seen they have a craving for sugar or sweet taste when they have this, prodrome stage of a, migraine attack. They may have constipation, diarrhea, and GI upset, maybe with the bloating, and they may also have a lot of mental changes in terms of mood swings, unknown mood swings without any causative factor as such. Having a routine life, but still we have some kind of mood swings unexplained. So they're all factors which we need to understand. Probably is also causing a pre-attack situation, pre-attack of the migraine, which we present with. Sometimes I've also seen a lot of people don't try to drink sufficient liquids, especially the water. That dehydration and the geographical area where they're living, depending on the season and everything, if they're not having a sufficient adequate water, that also many a times causes this prodrome kind of a symptom in migraine. This may last for some time, like maybe 4 hours to 6 hours, sometimes 8 hours, or a day as well. And then comes the other kind of symptoms, which will progress to what we call it as aura. So in aura, we tend to see, a kind of peripheral vision, a blurred vision is there with our vision. And also the peripheral vision is blurred. We may not be able to see. In a normal life, I'm actually seeing my laptop right now, but I can see my windows, I can see my curtains. But probably in aura condition of migraine attack, they may not be able to visualize that. They may have a blurred vision about that. And also they may have sometimes ringing of the ears. Suddenly, they don't have that symptom regularly, but this is also a kind of factor to make us understand that when these symptoms are there, this is where we are in the migraine cycle. So we understand we can have some interventions to manage it and probably overcome it or reduce the intensity of the attack itself. That's why we need to understand, especially any kind of chronic disorder someone is suffering from, we need to be aware of the condition and also how we progress and tell your doctor or any other therapist about how things go on. They may be able to give valuable inputs for you to manage at that stage itself. That's why it is important for us to understand all these stuff. And also they may be very sensitive to smell, different kinds of smells, which is also a triggering factor, and also to touch sometimes. And some few tastes also may be disturbed. Suddenly you're not feeling a taste of something, or you're feeling excessive taste of another thing. So they're all some of the factors which we can see in the aura stage of migraine attack. And one more important thing, what I have observed is some people come with the symptoms of floaters. We sell floaters in the eye. Suddenly they start seeing in their vision, something is floating in a liquid, we have fluids in our eyes in different chambers. So sometimes in the aura stage of the migraine attack, we can see those, floaters kind of a situation as well. These are all the factors which we need to understand. Hallucinations are also mentioned, but it's very rare. It's not so much prevalent or not so much of a big presenting factor in the aura stage of the migraine attack. The third stage is the most longest stage. It can last up to 72 hours. That is the actual migraine attack itself. How does it present? Usually it presents with unilateral, either one-sided headache. It can be very intense. We call it as distending or throbbing, pulsating kind of headache. You'll feel as though I need to stab my head with some, knife or some instrument, that I need to get out of this. That's the kind of feeling what you will have. And sometimes it can be associated with uh, vomiting sensation, nausea, and stomach upsets, and also sometimes dizzy feeling, lightheaded feeling is also quite possible. And you feel as though you tie your head with a cloth, and I don't want any light, I don't want any sounds, I better sleep in a dark room, nobody should disturb me. That's the kind of attack what you have. It can last for 72 hours, but what I have seen. So That is how migraine develops in different stages. After maybe 48, 72 hours, it will go to the next phase, that is prodrome. That is something like residual effects of migraine, which you may feel very fatigued. You want to, lie down and sleep for some time and take complete rest to get away from this attack. And also, you may sometimes feel refreshed or happy as well. And many a times I have seen appetite can increase for specific foods like craving, and sometimes may not have any appetite as well. And most important thing is in the prodrome situation, you will feel weak and fatigued. That is something which we'll have to notice. This is how migraine comes along to anybody. If we understand these things, I'll come to the other part, the therapy part, when we can exactly tell how it can kind of help us to intervene in those phases to restrict its progress or reduce its intensity. As I mentioned earlier, migraine attacks or migraine headaches don't have a particular cause to name it as. There are only hypotheses. So these are the possible causes, is what we can say. But we cannot say just like a heart attack or a heart condition or cholesterol. Most of the chronic conditions, for that matter, it's very difficult to pinpoint to one particular cause that this is the cause of the condition. These are all multifactorial illnesses, I would say. It will affect multifactorial in the sense it can affect your physical aspect, it can mental aspect. So those mental aspects and imbalances can show triggers or changes in our physical body, which can trigger the headache. So that's why we don't know one single factor for migraine attack. And what one of the hypotheses is, as we understand, migraine attack or migraine headache is a neurovascular disease. Means nerves and the vascular system, the blood flow system in our brain is having a balance, which is causing some kind of inflammation, which is triggering the headache. To be very specific, there is some vasodilation of the blood vessels in our brain, around the brain. That is what is a known hypothesis for migraine attack. And why this happens? Vasodilation means enlargement of blood vessel. There could be several reasons why that happens. One of the reasons is some of the release of chemicals, what we call it as serotonin and CGRP, that is calcitonin gene peptide, which usually, for whatever reasons, kind of presents with increased secretion, leading to vasodilation in our blood vessels in the brain. And many times this happens because of the overactive of few neurons, the nerve cells, and that triggers the trigeminal nerve. Trigeminal nerve is one of the nerves in our brain, which is one of the cranial nerves, which supplies our trigeminal, as the name itself indicates. It is supplying three different parts of our face bilaterally. So there is some these neurotransmitter imbalances leading to the headache. But what we need to understand is the inflammation. Inflammation in the neurological uh, system in our brain is the main factor. As a hypothesis, we need to understand is the mechanism for migraine attack. The third one to say is women are more prone to migraine attacks. I probably believe it's because women are having much more variations in their hormones in the day-to-day life in every month with menstrual, and they're multitaskers. At the same time, they have several pressures, several roles they play. Not that men don't, but it's much more on the women. So that could be one of the factors for migraine to be very prevalent in women. And age, as I've already mentioned, it's in between the second to fourth decade of anybody's life. But recently, I have seen a gentleman who has had a migraine attack for last probably, in he's in 90s, but still he has, and he's on medication. I'm taking up that case, how it helped him in the later as we go along. So it can present, but mostly it is there in the second to fourth decade. Another important factor in migraine attack is one of the causes is the family history. When I see anybody, any patient with migraine, most of the times, at least about 60 to 70% of the time, there is one family history, either their parent or grandparent or some cousin, somebody also has migraine attack, migraine headaches. It's still not understood. One of the genes is responsible for the transfer. So that is one of the reasons why migraine come. But that doesn't mean everybody has that gene or a trigger for that gene should get migraine attacks. It is very simple. If by chance my parents are diabetic, imagine my both the parents are diabetic, I have about 50% of chance of getting diabetes. But it purely depends on how I manage my life, how I manage my lifestyle, how is my eating habits, how is my exercise habits, how is my fit, how do I react. All these factors are very, very important. If I'm having a very good lifestyle, probably I may not get diabetes at all. Same case with migraine as well. It's purely dependent on how we lead our lives. And I don't think so. Today is the time for us to understand lifestyle has become so important for a good state of immunity to even fight our pandemic today. So that's why, not even though understood that family history is one of the triggers, not necessary you have to get, but if you have the trigger, you need to be extra careful, extra cautious to understand that and probably take steps accordingly in consultation with your doctor or any other therapist so that you can prevent those attacks or frequencies of attacks or even the intensity of the attack. And also, we have seen that several other medical conditions, including anxiety, sleep disorders, and epilepsy, or all those things are also one of the chances, or those who are suffering with that also have a higher chance of getting this migraine attack. So these are some of the probable causes which we have understood in the medical science today about the migraine attack, migraine headache. Let us see what are the triggers. I mentioned earlier that these are all multifactorial. So there could be several triggers. Most of the migraine headache sufferers would already know these triggers, I believe. So I'll just brush through them. I'll not go in detail about it. First, most important thing is hormonal in women. I have talked about that just a few minutes, couple of minutes ago. Next is the stress. I have seen most of the migraine headache triggers in 80% of the triggers, it's stress. It could be any kind of stress, professional, personals, any kind of stress, emotional stress. They are of the major factors. Third one is food, different kinds of food. I'll come to that in detail in the next slide about it. And also I have seen skipping meals for various reasons. So that is also many times it's a strong trigger for migraine to come in. Probably not eating at the right times. If imagine every time you keep on skipping meals for various reasons, or you're just popping in something, maybe water or something to just because of your work or whatsoever it is, it will definitely cause a lot of variations in terms of our blood sugar levels, which will have an effect on our brain and the blood flow and the metabolism of the cell requiring the glucose can trigger the headaches. So don't skip meals. Sometimes even change of weather can trigger. One of the
Dr.
is
Gurdatta, your
in the
voice is breaking
sun
up a little bit.
is a major trigger apart from or is it okay?
Yes, a little bit. It's this crackling voice. So,
Oh,
all
okay.
right. All right, this is better. So I think we were talking about the triggers, what triggers on the
Yeah,
skipping meal part
yeah,
and the change in weather.
yeah. Right. Especially when it comes to change in weather, I would say a hot sun exposure is one of the major factors for triggering the headaches. Out of 10 people, if you see migraine sufferers, at least 8 of them would say, when I go out in sun, hot sun, it will trigger a headache for me. So that is a very common factor to understand. I'll come to that little later, why and how it can cause. Probably hot sun is one of the causative factors in terms of inflammation and neurotransmitters changing. probably. Even I am not very clear about that, but it is one of the factors. But in traditional medicine, it is understood in a different way. I'll come to that later. And also some sensual activities, in the sense like excessive exposure to especially our eyes, excessive exposure to small screens, lights. When you see your mobile phone, smartphone for a long time, your tablet or computer, a laptop for a long duration of time, and if you're not sleeping well, those lights can be also a trigger for us to trigger a headache through the visual sensual visual activity. At the same time, some strong sounds. Most of the time, we can hear today that we are wearing headphones or earphones, even in our day-to-day activities, and hearing to different kinds of musics, which is good, which will help you to relax. But at the same time, if it is too excessive, it can also trigger our migraine attacks. And lack of physical activity. Lack of physical activity today has shown that is one of the major factors for low grade inflammation in our bodies. So this low grade inflammation can also be a trigger for migraine attack. So I would generally say most of my patients, if you're working for long hours in the day, please don't sit more than 30 minutes in one particular position. I was very happy when Amitaji told your duration of this webinar is 30-35 minutes. So I thought after 35 minutes, I can move out and walk around. So it's very, very important that we, make sure that our inflammation levels in the body is at a very low ebb or nil for that matter. So even tobacco, change in the sleep habits will also trigger these migraine attacks because of the low grade inflammation. Many of my patients tell me that I am sleeping 8 hours a day. I would ask, what's the time you go to bed? What time you wake up? Human being is just like any animal on earth, just that he is much more evolved than any other animal on earth. But we are not devoid of nature. We are part of nature. So there is a meaning why most of the natural activities, animal species and plant species, they when the sun sets, they just sleep. Their activities are at the low minimum, except for some species who are night related species. Probably they've adapted to that over millions of years, but we are still part of we adapt, and our bodies adapt, our hormones adapt, what we call it a circadian rhythm. So we need to follow those things, like in the sense you have to have the food at the right times, and is go to bed at the right times, and you have worked the whole day very hard for what for your earning, for your family and livelihood and everything. It's time for you to kind of sleep also pretty well at the right times. I would recommend go to bed by 10, wake up by 5 or 6, do some exercise. So those habits of changing sleep can have a big effect on our circadian rhythm and thereby hormones, and thereby leading to low grade inflammation, which is a major factor of triggering migraine headaches. So these are some of the triggers which can cause migraine headaches.
All right.
Amitaji, let us go a little more
Yeah,
next slide to understand.
let's talk about the holistic perspective now that we understand the triggers and the causes.
Yes.
So
I would like to bring in this concept of a Panchakosha theory in terms of Vedic wellness. In many of the Vedas, Vedanta, we understand the human being is made up of 5 different layers. The most basic is we are not just physical body, we are much more than that. So we need to understand that. The most basic one is Annamaya Kosha. Annamaya Kosha means we are this flesh of blood, muscle, bone, heart, all these things. We were just a single celled organism in our mother's womb when she conceived, but we grew this much. How did it happen? Would it happen without nutrition? It has to need nutrition. So that is what we call it as Annamaya in Sanskrit, because of food, this layer. This is the physical aspect of our physical being. So that is possible by food, exercise, metabolism, sleep. All these factors are responsible. These are the activities, physiological activities, which happen at the Annamaya Kosha level. So, the migraine headache, what you experience with several symptoms, are at Annamaya Kosha level. One-sided headache, nausea, vomiting, all the phobias with light and sound and all those things is happening at the Annamaya Kosha level. But we have understood very little about the factors which are triggers and real factors, how it happens though. But these are the factors which are responsible for imbalances in the Annamaya Kosha. If you're not eating at the right time, if you're not exercising, if you're not sleeping well, that will cause disturbance at the Annamaya Kosha level. Next subtle layer is Pranamaya Kosha level. We call Pranamaya Kosha is nothing but prana, means breath. Breath is a very, I would say, in eastern part of the world, we understand that when someone passes away, we tell that he lost his prana. In the sense, his life is lost. It's not just the breath. Breath is a simple translation, but prana is much more than that. So pranamaya kosha is deal with our energy patterns. We understand in traditional medicine sciences that it is breath and energy, which is meant for pranamaya kosha. Pranamaya kosha is something which is subtler than Annamaya kosha, but you can feel it, but you cannot see it in your naked eyes. I can't see oxygen in my naked eyes. I can't see breath in my naked eyes, but I can't live without it. So it becomes that more subtler, so that much more powerful. Can we have any better time to understand how breath is important today in the COVID time? So our respiration, our lungs are the one which is getting affected. So that is very, very important for us to understand. The next level is Manomaya Kosha, the mind, the emotions. We all understand that most of these factors, our diets, our factors of exercise, sleep, and so many aspects of that is related to our mind. I know that my body is asking I have to go to bed by 10:30 p.m. But my mind is telling something. I have some work. I want to watch a movie. I want to watch a series. So I'm overcoming that. Even though the body is asking, the mind is much more powerful with its desires and emotions. So I cannot see my mind, but it's much more powerful. That is what we call it as Manomaya Kosha, which is much more subtler. So any imbalances in terms of Vedic healing, especially it applies to migraine and several other chronic ailments, that any imbalances in Manomaya Kosha level over a period of time, you are under stress and you're not following your day-to-day routine life very systematically, then that will cause a lot of emotional imbalances in terms of probably stresses in professional life or anxiety and depression and all those things. Those imbalances lead to imbalances in our pranic energy or energy level. That will take time, but at the same time, once those things, body has the capacity to overcome all those things. But I have been pressing on those imbalances for a long time, lot of emotional disturbances and stresses. So that will cause much more deeper effects in the pranamaya kosha level. One day it will show it as a disturbance in our physical body. That is annamaya kosha level. A simple example for migraine: why do I want to eat sweet or some kind of chocolate? Chocolate is known as one of the major triggers for migraine headaches. I have a sensation, I have a desire to eat chocolates. So that desire comes from my mind, manomaya kosha level. But probably in a hour or two, I see a headache coming along. So that causes imbalances in terms of pranamaya kosha and probably leading to a physical symptom. That's a simple example. The same way, stress is also a factor. And I mentioned about dehydration or inadequate water intake. Whenever we have inadequate water intake, that is the trigger for a migraine attack. Why is that happening? My body is telling me I want little water. I am dehydrated. I may not be able to drink. I'll drink something else, maybe caffeine or a sugar based drink. So that is all related to our from the manomaya kosha level. I'm not hearing to my body. So that will cause a imbalance in our pranamaya kosha, then thereby relating to a physical symptom in annamaya kosha level. So holistic perspective when it comes to that, we need to understand that we need to deal with annamaya kosha level to balance. We need tools to balance our pranamaya kosha. We also need tools to work at manomaya kosha level. That is where multifactorial aspects of migraine attack can be addressed. It has a and natural way of balancing or managing this migraine attack to a large extent in terms of intensity and also frequency. I don't want to touch upon Vijnanamaya Kosha and Anandamaya Kosha. Amitaji, it is okay to address for me, or if time
Yeah,
is there, I can go ahead.
We have 10 minutes only. We want to open it up for questions. There are questions coming up. So we'll wrap it up in next 10 minutes or so.
I would just put some light on Vijnanamaya Kosha. All Vijnanamaya Kosha is the intelligence and analytical part of our being. Simple thing, again, we would always say that our mind is asking for some kind of sweet to eat for whatever reasons. Let us not delve into that. But my intellect always tells, is this sweet okay for you? Is this good? I'm diabetic. I should not eat sweet. But my tongue doesn't hear to it. I tend, even though my analytical mind, my intelligence always tells, I'm overpowers. So Vijnanamaya Kosha is to guide us in the right path, but here to it. So it's very important that we are aware of those things. So imagine your Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, and Vijnanamaya Kosha are in a perfect balance. Whatever your intellect is mentioning, there is your mind there to hear to it and follow it. So there are no much of disturbances in our Pranamaya Kosha. So no much disturbances in your Annamaya Kosha. You're eating at the right time, you're sleeping at the right time, and you are making sure you are knowing the triggers of so and you are avoiding those triggers as much as possible, not to cause an inflammation. So to a state of complete happiness, bliss, contentment. That is Anandamaya Kosha. Knowingly or unknowingly, we are all looking for that. But we don't understand that. So when you follow a regimen of traditional healing medicine in terms of acupuncture, in terms of yoga, in terms of diet and nutrition, naturopathic medicine, all these things is aiming at bringing a state of balance between all these four layers of our being. Anandamaya Kosha. So what could be the tools which can help us here? I would say at Annamaya Kosha level, we use acupuncture, we can use acupressure to bring in a state of balance in terms of, uh, uh, energies and also the physical imbalances. I have one of the studies recently I was studying about was that when acupuncture was applied of course, acupuncture can be used at different levels. Mostly at Annamaya Kosha, only you have to put the needle to different acupoints in the meridians, leads to a lot of changes in terms of reducing the inflammation and also the neurotransmitter levels getting lesser and improving the blood flow in your brain. So those are the factors which has been seen as hypothesized that it can help with migraine also. And also I have seen some hydrotherapy or water related compresses, a wet compress on your abdomen, on your forehead, on the eyes. They are also a good factor to bring down the tension, thereby the triggers for the headache. When regularly used, of course, with the recommendation of a qualified naturopath around you. Even massage therapy, several conditions I have seen migraine attack is triggered because of neck constantly seeing your monitor for a long period of time, stiffness of the neck, which kind of triggers the headache from the occiput to the frontal area of the head. So, massage, as we all know, it can help us to relax pretty well in terms of muscular level, improve the blood flow, and also gives a very nice relaxation effect. So at Annamaya Kosha level, we can have all these things along with a holistic diet. What I mean to say about holistic diet is uh, balance of all the tastes, and also you have to eat according to the region where you and your ancestors were born and have been living. And at the same time, your food should be as fresh as possible. These are the factors which needs to be taken care. At the same time, we also need to understand today the food industry or the foods are filled with a lot of fertilizers and chemicals and pesticides and all. Let us look at organic. That puts a lot of less stress on our system, thereby which can contribute to lower the inflammation in our system, which is a strong factor, triggering factor for migraine. And in terms of yoga, we can use several postures which can help us to manage our headache to a large extent. At Pranamaya Kosha level, we can use breathing techniques. I myself have used a lot of breathing techniques in terms of to manage the migraine attack, or when it is in just a pre-drone stage, and you can actually use the intensity, and sometimes you can actually get out of not getting into the attack stage at all. That has been my personal experience. All you need to do is simple, sit in a very comfortable posture, work on your breath, focus on your breath, calm down yourself. That itself will do magic sometimes. At the level of Manomaya Kosha level, I would recommend again acupuncture or acupressure to bring a state of calmness to our mind, so that the triggers from the mind, the stresses are balanced out or minimized, so that when the triggers are less, probably frequency and intensity of headaches also will reduce. Some of the important techniques in yoga is yoga nidra. It's a yogic sleep with instructions from a therapist, which could help to a large extent
Dr. Dr. Gurudetta, your voice is again breaking up.
techniques also could
Dr. Gurudetta,
factor
your
of
voice
one.
is crackle a little bit again.
Is it? Let me.
Now it's fine. It goes back and forth. So I think you were talking about the counseling and the relaxation techniques like yoga nidra, and then last
Yes.
one.
Yes. I would say even and acupressure also could help, because that gives a sense of very relaxation. This is one of the frequent feedbacks which I get. When you do acupuncture, at the end of the session, most of them feel, oh, I feel so much relaxed. I've never felt this for a long time. How does that happen? So you are surprised. So acupuncture can be a great tool to get a sense of relaxation. It is not necessary that you need to take this therapies only when you have a condition, a health condition, including migraine. You can have it even otherwise, to help stay in a state of, uh, I would say, anandamaya. That state itself will balance a lot of things and reduce the inflammation, probably reduce the trigger for the headaches. Even emotional balance techniques like biofeedback and counseling, all those things can be a major tool to balance our manomaya kosha.
All right,
I would just go to the next slide.
Yeah, let's move on to a case study, and we can tell our viewers how someone who had a migraine was able to control it with the natural therapies, as you've discussed earlier.
This is about I met a lady. Incidentally, she was a neurologist and she was from US. And she came to me that she's suffering from migraine for several years. So I diagnosed her on the traditional perspective, traditional Chinese medicine perspective. Can you see the tongue picture, which is on the left? You can see the purplish discoloration on her tongue. I cross-checked, did she eat anything day to cause that coloration? She didn't. That was her natural color then. We understand in terms of traditional Chinese medicine that when the tongue is purplish, there is some stagnation of energy in the body. And we need to delve in detail and lifestyle to understand accordingly and treat for a period of time. I had a patient for about 6 to 8 weeks in about 20 sessions. You won't believe her sleep improved, her headaches were almost nil. And I took a picture of her tongue when she was about to leave my center, her 7, 8 weeks of treatment. Can you see the difference? What was there, the expression is no more, or the intensity is so less. So that's the difference what we can make. But I don't claim this with every case I can do it. It varies from individual to individual. And also another important thing is when I do acupuncture treatment, I always tell all my patients, allow the treatment to happen to you. Don't have mental restrictions for yourself. Come with an open mind and surrender yourself for the treatment. It can do magic to you. Can we go to the next case, Amitaji? This is one of the cases.
Yeah.
By the way, this lady also had restless leg syndrome and sleep issues. That also managed pretty well. Right. This is another case where I recently did for about a few months back. This gentleman, which I was talking to you about in the beginning, that he was 71 years old with a history of 35 years of migraine attack. Almost every day. His daughter is a neurologist. She did all the necessary tests with the top neurologist consultations, and everything was normal, no problem at all. But he had also associated symptoms of hypertension, gastritis, and peripheral neuropathy, all this stuff he had. A lot of issues with his stomach as well, which is one of the triggers. GI system disturbance is also a trigger for migraine attack. So I had to address all those aspects to him. And he was a very perfectionist kind of a gentleman who had worked very hard to come up in his life and settle fully. And even professionally also, he was very ambitious and too perfectionist, which are all triggers for him. No doubt when you're in the prime of the age, you can manage. But when it's going beyond the line, that those things add as a stress, and you are neglect your probably sleep, eating habits, and you eat all kinds of junk foods, that could trigger the headaches. And when we are in the prime of the age, we take medication and pills and manage it. But after some time, that doesn't work. This is a functional disorder. So I treat him, and this gentleman had a lot of explosion of angers very often. That's also another stressful factor to trigger migraine attacks. So I happened to treat him for about 3.5 weeks. You won't believe, uh, for quite a few days. Every day, almost every other day, I used to treat him. And whenever I treat him, the next 2 days, no headaches, literally no headaches, which he was suffering for almost 35 years. So that's the
That's an
benefit of what we
incredible
can.
story. Yeah, that's an incredible story. So did you use combination of, like you said, acupuncture, yoga,
Yes.
and what were the therapies that you used?
I used mostly acupuncture and with advice on the nutrition and also breathing exercises. It is, as I mentioned, multifactorial. Some yoga techniques which I taught him to practice at home, and a lot of changes in terms of food I mentioned, which were the triggers at home, other than the general factors that helped him. That's how he became much better. But unfortunately, if you would have continued, probably I would have managed him much better.
Yeah.
So
All
all
right.
these require time to interest and get over and manage it to a large extent.
That's wonderful. Let's just open up for questions. We have quite a few questions coming up, and we are only 10 minutes left. So, I think that there's a beautiful stories. Hopefully, the viewers who are watching can see how migraine can be easily controlled with different natural therapies, as Dr. Gurudatta has explained in a beautiful way of how you can have different layers. So, we have a question that's coming up. We are open for questions, by the way. Please type it up in the chat. Does reoccurrence of migraine headache decrease after some age, maybe after menopause for ladies? You touched upon this topic, but could you explain that a little bit?
Yes, definitely. I have seen in my experience that when you're in perimenopause and postmenopausal period, a lot of hormonal changes. If we are addressing, if you're going through a smooth phase of menopausal time, the headaches automatically reduce. The reason is still not understood very clearly, but we attribute it to probably the hormonal variations in women, which causes that. For men, also probably there are hormonal variations, not menopause, but they also have some, middle-age issues, variations in the hormones, which could be the reason why once you pass over that, uh, you may have less intensity of headaches and frequency also. And at the same time, probably I also think that suffering with migraine headaches for nearly 1.5, 2 decades, you're matured enough to understand what it is. You will avoid a lot of triggers. You will do a lot of self care. And all those factors would actually help you to heal to a certain extent, that low grade inflammation reduces. Thereby, probably you don't have headaches after a certain period of time, after a certain age, especially after menopause.
Okay. All right. I saw someone had raised a hand. Let me just see. Yes. Okay, thank you for the wonderful session. You're welcome. Please help us spread the word and share this session. We will be bringing more sessions from Dr. Datta. Any other questions that you had? I saw someone raise a hand, please. So please put all your questions in chat. Okay, while someone is looking at it. So I would say one of the questions I had, the two cases that you shared, both the cases, did you apply acupuncture, you said, along with the yoga, along with the diet? Would those be the three therapies, or was there anything else like acupressure or?
Yeah, what I used to do generally is I used to have done in a particular frequency, maybe 3 times a week. And also, I used to give them homework in the sense
I,
like start using those acupressure points back at home. And also, if you tend to have the prodromal symptoms of migraine headache, use these following acupuncture points or acupoints, what we call it as, at itself. How do you trigger them through your self acupressure techniques so that you can prevent the headache to progress? So that also was one of the things. And I used to talk to them about, taking care of their food and eating at the right times, and using some hydrotherapy, water therapy compresses, wet compresses on the abdomen, on your forehead and the eyes. Sometimes even mud therapy has helped to manage. Even though it was difficult to acquire that mud and process that also has helped. And even in drinking sufficient adequate water, pure water, has also helped to a lot of people. That's what I have kind of asked them to do. And yoga nidra techniques is something which generally most of my patients, including more so with migraine headache, because I ask them to practice almost every day when their intensity of symptoms are very high. And many people have come back and anxieties are so much better, my stresses are so much better. I never felt this experience earlier. I don't know where. That was the feedback which I get when yoga nidra techniques are given. And eventually, it leads to less migraine frequencies and intensities as well.
okay, thank you. Yes. Other questions, please. Dr. Guru Datta is an certified yoga instructor as well, and we will be bringing some group therapy classes from him for specifically for migraine and some of the other ailments next month in September. So, but this is an intro session, where he educates you what the triggers are and what the therapies are on a very high level. So we are open for question and answer before we wrap up. Any other questions? Okay. So I think now the two cases that you talked about, are they still coming to you? Are they still your existing patients, or they have stopped coming to you? What I'm trying to understand is, after you said 10 sessions, are they doing it self care, or they're still in consultation with you?
I have been in consultation with the first lady for quite some time. I had seen her almost a few years, more than 5, 6 years back now. And when I spoke to her last time, her frequency of headaches were much, much lesser.
That's
It was
wonderful.
not that great.
Okay.
She was managing without medication many a times. Of course, when you stray off the street of the line with your triggers, you are supposed you would get it. But even if the intensity and frequency is lesser, that's a big achievement. I wouldn't say, I wouldn't claim that I can cure a case of migraine completely. Even to a large extent of reduction in terms of intensity and frequency, that makes a big difference.
Yes, yes. I love the way you talk about the different layers, the koshas. I think that's a very powerful concept and very easy to understand. All right. So I think with that, I would like to wrap up this session. Before I wrap up, any final words from you, Dr. Dutta?
Yes, my final view is that take care of yourselves at every level, at your physical level, address your pranamaya kosha or energy level. Sometimes you feel, oh, I'm fatigued today. So go with the day accordingly and take care of your emotions, have a balanced emotion, have a lifestyle regimen in terms of your food, exercise, and mind. When you do that, you are living a balanced life. You have every ability, and your body is robust enough to fight any kind of situation, whether it's infectious or not infectious. I would say in this pandemic situation, we have understood immunity is the most prime aspect. How to maintain immunity? It's not through medication and supplements. It's only through lifestyle. If we maintain a good lifestyle, your immunity is at peak. And if you maintain a good lifestyle, your inflammation is low. All your cells, all the organs are functioning at its optimal level. When that is the case, you can fight any condition, including hypertension, diabetes, cancer, migraine, blah, blah. Things go on. Sometimes we can even say that genetics, even our genetic things won't be triggered to cause a chronic ailment. That can also be suppressed. Science is coming to that gradually to understand that. So, to maintain a lifestyle, please make sure your manomaya kosha, pranamaya kosha, and annamaya kosha are in complete state of balance. That's my take home lesson, probably.
Take home test for all of us, that we balance our koshas. Those are beautiful, beautiful concepts that you've explained us earlier as well. And I think we should have one session only on the koshas and how to have the koshas. This is really beautiful. Well, with that, we thank you so much, Dr. Datta, for coming. I thank all the viewers. If you like hope you like our sessions. We bring every week different sessions, educational sessions. So please help us spread the word. Please help us share, all our sessions, all our videos. With that, I want to thank all of you for being with us. Thank you so much. Have a great day. This is Amita. Namaste.